Great, thank you so much. Just while people are joining, I think in the interest of time, I'm just going to continue. Just to sort of link before we lost the space with where we are now. I was talking about how within the South African context, there are these protections that we have in the Constitution and in various other pieces of legislation that govern health and the environment, that guarantee, our health and well-being and, our access to an environment. Unfortunately, even over and above this, we still live in a country where there are substantial amount of environmental risks that are brought about, by various things. Now, when we're talking about environmental risks and the driving factors behind the environmental risks, they are the reason why currently and nationally the environmental health profile of the country is as it is. These risks include things like urbanization. When we're talking about urbanization, we're talking about, the growth, the urban growth that is happening in areas of already existing poverty, and how, we're having issues with access to housing, access to land, and how housing is actually a determinant of public health. Because if you have, houses and in a proper location that are designed well, that are healthy, it can actually lead to prevention of diseases, promotion of health, and the creation of healthy, sustainable communities. And if we think about industrialization, agriculture, and mining, although they contribute substantially to the national economy, they're also responsible for environmental contamination and degradation. So, I mean, if we think about Mpumalanga and the issue of air pollution there, the mercury-related deaths in KwaZulu-Natal, and if we think about, the degradation of local environment around the mining communities in Johannesburg, and just simple poor management of pesticides and how, in essence, they affect land, they infect water sources. And when we come back to informal sector and cottage industries, also as a risk factor, we're talking about places that serve as residences and cottage industry operations. So things like jewelry making businesses that expose people to hazards like lead, volatile and organic compounds. So we have these environmental risks: air pollution, water pollution, and climate change that are caused by various things that result in various diseases. Air pollution, for example, respiratory infections, heart diseases, lung cancer. When we look at water pollution, you can get malaria. We have a very bad rate of diarrhea in South Africa. You can get cholera. And the realization is that, climate change is at our doorstep. And with increased temperatures, with precipitation, with storms, cyclones, and other extreme weather events, our air pollution is worsening. There's an increase in pollen production. There's changes in the distribution of vector diseases. And ultimately, climate change is going to result in, food shortages, malnutrition. It will definitely impact on our mental health and well-being, and it will impact on communicable and non-communicable diseases. So, what is the way forward? It sounds quite daunting. And I think not to make it daunting, but for us to realize our current context and to continue to have conversations around it. When we think about, what we need in order to progress and ensure that, the issues that we have towards, environmental risks and how they impact on our health, we think about, the health budget and the environmental budget and what it is that, SONA 2022 means to us. If we look at SONA 22, we realize that to the health budget will impact on us because it will impact on backlogs in service delivery, in the standard of recovery of the healthcare sector, and obviously towards us going towards universal healthcare. And already we are struggling with shortages with human resources for health. And when we think about the environment and how the budget looks towards the environment, we realize that currently in South Africa, coal is the single biggest contributor to the current climate crisis. And it contributes to almost half of carbon dioxide emission worldwide. And it accounts for more than 70% of total greenhouse gas emissions. This is huge. And, during the SONA 2022, we didn't hear a lot about, the climate bill that was tabled before Parliament, for example, on the 28th of February this year. We didn't hear a lot about the plans that the government has in reducing, coal and our reliance as a country on coal. And this is quite upsetting. So I think for the time being, I would like to leave it there as food for thought. And I would like to also hand over the space to other colleagues to talk more about the human implications of what it is that I've discussed within the South African context. So over to you, Mafoko, Aziza, and Tepo. Thank you so much.
Thank you, Tlamelo. You've really set the scene and given us a picture of the current context. So particularly, as we mentioned, we work for Groundwork South Africa. It's an environmental justice organization, and we work on different campaigns. We work on climate and energy justice, coal and environmental health, as well as global green and healthy hospitals and waste. So we work with communities in Mpumalanga. You've mentioned that South Africa is very dependent on coal in order to generate power. And so as many as 2,000 premature deaths have been attributed to air pollution from power plants in South Africa. And the communities in Mpumalanga are hard hit. And you've mentioned already the health impact or the health outcomes are respiratory illnesses, such as lung cancer, stroke, heart disease. And particularly in children, we see developmental delays, right, due to them being exposed to, air pollution from coal mining and coal-powered stations. And this also affects their right to access education, because if they're ill, it means they won't be able to go to school. So it really is a child rights issue. And the work that we've done at Groundwork is that we have partnered with community-based organizations that live and work in Mpumalanga, and in order to raise alarm around the high levels of toxic air in Mpumalanga. And that area has been classified as a high priority area by the government itself because of the high levels of toxic air. And so in trying to raise alarm, Groundwork and an organization called the Vugani Environmental Justice Group took the government and the president, as well as the Minister of Environment, Fisheries and Forestry, to court to kind of highlight that the constitutional right of living in an environment that isn't harmful is being contravened by the mines in Mpumalanga. And so this is dubbed the Deadly Air case. And this case started in June 2019. The idea, as I said, is litigation demanding that the government clean up the air in Mpumalanga. And recently, in March 2022, Judge Collins actually declared that, the High Court recognized that the poor air quality in Mpumalanga is a constitutional right issue, and it breaches the residents' constitutional right to an environment that is not harmful to their health. And so this is a landmark case, and the idea is that the government needs to enforce the Air Quality Act. There's an Air Quality Act, and so they need to ensure that they clean up their air, basically, in the Highveld in order to meet health-based air quality standards. And we know the issues of climate change that you've mentioned, and Groundwork is also participating in the Presidential Climate Commission. Our director, Bobby Peake, is a commissioner, and notably within this commission, which the commission is is independent, and it's a multi-stakeholder body established by the president, and its purpose is to oversee and facilitate a just and equitable transition towards a low emissions and climate resilient economy. But notably within this commission, health is not represented, and this is an issue that as the Public Health Association of South Africa, under the special interest group Climate, Energy and Health, we are concerned, and we have raised alarm about the non-inclusion of the Department of Health as part of the commission. And so this raises alarm. But just to say that the commission has been conducting community consultations in various communities that are affected by power stations, by refineries, for communities to contribute to what they understand as a just transition to be. And but as we know, communities are always consulted last, and so the commission has put together a framework, a just transition framework, and they are now wanting input on the framework, but it has been already developed, and so communities are really disgruntled around that. And they want to understand how the renewable energy economy will look. What will it look like? And as far as provision of jobs and the local economy. So really, these are the concerns that the communities have, and they demand that the just transition should ensure that renewable energy is incorporated within the education system. It should also address issues of unemployment as well as improved health services. These demands are not new, because these are social services that communities should be getting but are not getting currently, as we know and as has been highlighted. I'll hand over to Aziza and Tsepo to probably highlight the contribution of the health sector to greenhouse gas emissions. Thank you.
Thank you, Mafoko. So in South Africa, when we talk about health, since it's World Health Day, our primary healthcare system usually fails us in South Africa, and a lot of the health we do is curative and not preventative. What we're trying to do as the health sector, taking ownership about our role in climate change, because there's a big driver of climate change in our procurement processes. We procure a lot. We're a big procurer of plastics. How we manage our waste. Most of the waste by legislation in South Africa should be incinerated. And we're looking at alternative ways of how we can handle waste. I mean, the health sector should be focused on healing and not contributing to the climate crisis and the bad health effects that it does. So, I mean, Tsepo is one of the people who have signed up to Global Green Healthy Hospitals, where we aim to reduce the environmental footprint and promote environmental health at the facility level. Tsepo, could you just shortly, speak about the initiatives of how the health sector is trying to improve on sustainability and how it actually improves the health system, apart from just saving the planet, but how processes, how sustainability being streamlined into processes help with the health sector, taking accountability for its role in the climate change race?
Okay, thank you, Aziza. Well, I forgot to also mention that I was inducted as a climate champion for my institution. Now, this is based on the initiatives that I've undertaken since I've joined the Global Green and Healthy Hospitals Network. So, with that being said, as an environmental health practitioner myself, there are those initiatives that we undertake that promote or that are aimed at reducing the environmental footprint and promote environmental health at facility level. And since we have joined this network, we have undertaken initiatives following, I think it's 3 goals that we've undertaken initiatives or written case studies about. We've got case studies on waste, energy, and leadership as a whole. So with waste, we have undertaken an initiative whereby we were aiming at reducing the amount of waste that we generate. Because now at the hospital, the amount of waste that we generate gets treated, and also money gets to be spent in treating this waste that we generate at the hospital. But now, what is not being said out there is that there are also environmental footprints that are occurring when you treat your waste. So the initiatives that we undertake or that were taken by myself and other champions in different hospitals were aimed at reducing our waste. Simply, we would train people or our custodians on segregation and best practices in waste. Also, with regards to energy, we are focusing on reducing the amount of or the dependence of the health sector on electricity, because now when you look at ESCOM is dependent mostly on coal-fired uh, coal-fired energy stations, whereby most of our electricity is coming from coal. Now we wanted to come up with initiatives that makes us use less or green energy. So for an example, we have undertaken an initiative last year whereby we are replacing our fluorescent bulbs with LED lighting, which is a green sustainable initiative. Because now when you look at your fluorescent bulb, this contains mercury, which is not good, which is harmful not only to the environment but also to the human health, because when you get exposure to mercury, you're going to get sick. So we are undertaking all these initiatives aimed at reducing environmental footprint, also aimed at improving our health as individuals and communities where we are. So also, when you look at pesticides, we came up with a strategy called the IPM, which is Integrated Pest Management System, whereby we were looking at alternative ways of maintaining or controlling pests that you can find in your environment. Because remember, we as humans, we tend to have practices whereby we promote unhygienic conditions in the areas where we stay. So normally we tend to have pests attracted to the practices that we undertake. So we needed to come up with an alternative solution, in terms of pest control. And that's when the IPM was introduced. I think in Free State, where I am based, it was introduced in 2019 as a transversal contract now. So we are having all these initiatives, that aims at addressing climate change and climate health. So it's not only me. We've got other colleagues and EHPs employed at different spheres of government, but mostly we are focusing at EH professionals that are at facility level, and then we would want to measure now the impact of the health sector as far as EH is concerned, or as far as climate change is concerned. So this small initiative that we undertake under the guidance of GGHH, because now when you sign up for GGHH, you've got what we call the guidance document, and you sign up for goals. So some of the goals that are there are about 10. Some of them are related to a sustainable goal that you would want to achieve, as far as addressing climate change is concerned. So I'm very proud to say we have undertaken some small initiatives aimed at this. And also looking at waste. For an example, we've got a national waste management strategy that talks about zero waste to landfill by 2030. And then when you look at me, for an example, at the hospital that I am, I've got initiatives that are aimed at promoting that. For an example, already we are recycling our waste. We are monitoring and evaluating this initiative in as far as to ensure that whatever that we are doing has an impact towards what we want to achieve, which is zero waste by 2030 to the landfill side. So already we can see that we are reducing the amount of waste that is going to the landfill by doing or taking on a recycling initiative. And recently, I think it was 2 or 3 weeks back, where we recently celebrated the Global Recycling Day, which was an initiative now whereby we wanted also to invite individual community members, to start to apply themselves in these initiatives that are aimed at promoting recycling, as well as now addressing the goal that we want to achieve, which is zero waste by 2030. So there are small initiatives that we have undertaken, both either myself as a fellow, or either under the GGHH network. So there are those initiatives that we have undertaken. I'll just pick there for now. Thank you.
Thank you so much to Aziza, Mafoko, and Utsepo. I mean, some amazing initiatives that you have just mentioned. And I think it is absolutely important rather, that we get to the zero waste that you're talking about within the time that we have. You mentioned how it is that one of the recycling initiatives as well is trying to reduce, the amount of mercury in simple things like light bulbs and the kind of light bulbs that you use, which I think was absolutely important because if we think about, and I think Mafoko was also talking about, reiterated the reliance of the South African sector on coal. I mean, at the moment, South Africa is about 80% dependent on coal, and it is responsible for about 89% of Africa's coal generation. It's huge, absolutely huge. And in addition to that, South Africa was named the worst sulfur dioxide polluter, and this is primarily because of Eskom. And sulfur dioxide, as mentioned, causes air pollution, and it occurs from what? Coal burning. I think it's quite important, these initiatives that have been taken by ordinary people within our societies, that are directed towards actually dealing with the issues of pollution within the context, and how it is that we want our environment to be healthy so we can be healthy. I mentioned earlier on, the climate change bill, which was tabled in Parliament on 18th of Feb 2022. And I think that we should be hearing out or listening out or seeing calls for contributions towards this bill. So I'd like to encourage everybody to also look out for calls towards the climate change bill. In particular, when I was taking a look at the current bill, there are two things that for me were incredibly important. The one was the adaptation strategy plan, which is supposed to reduce the vulnerability of society, the economy, and the environment to climate change and to enhance our capacity. And then the climate change response, which is going to be required of all provinces and municipalities, and they need to respond and have an implementation plan. So quite exciting developments that I think are coming in legislation. But I think we all know that, having pieces of legislation are great, but it's how those pieces of legislation are implemented that make it even more important. We were going to hand over as the next session to a fellow who is going to talk about solidarity and advocacy. But I think that perhaps we should sort of talk about mental health first, and then deal with the solidarity and advocacy afterwards, because I think that it's quite important. It's quite an important topic. That being said, I'd like to encourage everybody who's in the space, who would like to engage, who would like to ask questions, please feel free to do so. We'd like this to be a conversation rather than, us speaking to you or, any kind of a lecture. So please let us know how you're feeling about the conversation as it's going. Please feel free to ask questions. Please feel free to contribute whenever it is that you'd like to. So, talking about mental health within the South African context, I see that we have Dr. Jeffries that is also currently in session. And I'm told that Dr. Jeffries has, speciality or background, if I'm not mistaken, and is a retired mental health counselor, if I'm not mistaken, according to your profile. Please feel free, Dr. Jeffries. I think we would love to hear from you with regards to this issue of how Dr. Jeffrey Guterman, how our mental health is being impacted by, environmental health as well. I think that it's an important conversation because, we currently know what mental health looks like in the South African context. We know that we need and we lack currently a sustainable financing model around mental health. And there seems to be a very quite substantial gap between mental policy directed towards mental health and how that policy is actually implemented. For example, we've got the Mental Health Care Act, we've got the Mental Health Care Policy Framework and Strat Plan. But yet, with all of this policy, in South Africa, there's still 1 in 6 South Africans that suffer from anxiety, depression, and substance abuse. 40% of South Africans living with HIV have comorbid mental disorder. 41% of pregnant women are depressed. 60% of South Africa could be suffering from post-traumatic stresses. And out of all of this, only 27% of the population actually receive treatment. So outside of our ordinary mental health issues, there's also eco anxiety. And eco anxiety is anxiety, depression, despair that is brought about by the current state of our environment, and by people feeling helpless towards doing anything about the current state of the environment. Air pollution studies done by psychiatry research have shown that there's a link between air pollution, depression, dementia, anxiety, and suicide. Lead and heavy metal toxics are bad for our nervous system. They also impact on our mental health and how we go about. And we know that, in South Africa, your health is not just the absence of disease, like the World Health Organization was saying. It goes over and above just being an absence of disease. It also talks about how it is that you're able to thrive in the environment. And if the mental health facilities are not there to cater for the ensuing climate changes that are going to be coming, I think that we're going to be a country that's at risk. I'm very, very interested to hear from speakers and fellows that are on here that do the work, from Aziza Mafoko, Sibongile, and Tshepo, about what your experiences have been and what your thoughts are about how it is that our mental health is impacted by the current state of the unhealthiness of our environment. So over to you. I think we'll start with you, Sibongile, and then we'll go through to Aziza Mafoko and then Tshepo. Please, the listeners, also feel free to tweet. How is it that you feel the mental health is being impacted? Mental health of ordinary citizens that live in, places where there's issues with pollution of water sources. As you walk out your door, there's pollution right in front of you, where you have to live around the corner from a rubbish dump. How is the mental health of ordinary people that are affected by, the degradation of our environment being impacted? Thank you so much. Over to you, Sibongile.
Okay, thank you very much, Lamelo. And from all the previous speakers as well, there's so much energy and good link on what has been presented. But I'll approach it from that perspective, or from that angle of mental health. I'll just give a story. Storytelling is much better for me. The life of a human being, in particular, begins in water. So the pregnancy, the child is in water for 9 months. So we assume that is undisturbed stage of being in water, and it becomes a stage where the child arrives, and the water is being used as the first thing that has to touch the child, of course, beside the hands of the midwives. And what happens after that, and I'm going to take it into the eyes, in the lenses of girls and women. Water becomes a challenge then when a girl approaches a stage of 10, 11 or more, or even a bit less. So what does it mean? It means water is such a huge determinant of health, not just physical health, but also of spiritual health for anyone. But at this stage, the girl approaches this life of being in the patriarchal society. And I'm going to give an experience of girls in the rural areas where patriarchy is still very strong, where gender roles are still being very recognized. And one role that the girls carry is the burden of carrying water. And we see this as a disruption, because from birth, the water has been fine. The relationship of the baby, the girl, has been fine. But at this stage, that is where we see a problem, that gender separates and makes water to be a burden on girls while it's not in inception. What happens in these communities is that on the way to fetch water, the girl has got a painful story to write so far. And that story is related to being abducted. So it means the shortage of water because there's a shortage of water in communities. So the shortage of water is a problem on its own, it's a health hazard, but also the gender perspective is also a hazard on its own, because it means the girl can be abducted for early marriage on the way to fetch water. The girl can be raped. The girl can be harassed on the way to fetch water. And what that builds in the self-esteem of the girl, and what that does into the psychological, emotional well-being of the girl, and the trauma they carry. In most cases, that trauma is not known. That trauma is not being spoken about. So that on its own affects the mental health of girls, and that is because of the gender disrupting the whole pattern that is good of water, and then bringing the trauma of abductions, harassment, and everything. So what we know and
Sibongile, we've lost you.
oh, sorry, can you hear me now?
Yes, thank you. You were just saying what
uh,
we know. Thank you, thank you.
okay, yes, so what we know is that today, if I can link this experience to climate change to begin with, is that climate change is going to add more on these patriarchal gender norms in society, because it means we are either going to experience wetting or drying, meaning a lot of dry seasons and a lot of wet seasons that we're not expecting, that are not in harmony with what we know. And what that means is that then there's going to be a shortage of water going forward. And we've experienced that a lot, but it's going to increase. But also on the other side, the water, if I can give another experience, when COVID-19 came, it didn't cause the communities where we live to have shortage of food. Everyone had enough food through the agroecology gardens that communities have established over the period of time. However, what we are seeing right now, this planting season, is that all the food that we have planted, most of it has died. And why is that? It's because of the excessive rain, which is not supposed to be at this season. And therefore, as local people, we conclude that climate change effects are going to kill us more than any other disaster that we have seen. And also, if I can put another case, during the July 2021 uprising in KZN, we still had food at least for the 4 months in our gardens. So it means we could survive in our homes. However, this wetting is not allowing us to survive, because all the food that has been grown in hope of sustaining the household, and also of sustaining our small markets, that is gone, totally gone. So climate change is going to add another stress in the household, but also in the lives of the girls in the communities. And we also realized that in the just transition consultations, when we read the documents, we can see that water is not in the document. And that is a huge concern for the girls and young women, because if water is removed, they are also not there. The girls are also not there in the document. So they see themselves as the removed group of people in the consultation processes. And they're trying by all means to bring their voices, their agency in the process, to say, let girls, young women, and water be the key in the just transition, because otherwise it would be meaningless for them. So these are the issues that we are facing at the moment, and we believe that they are inseparable. The water in its sense, as a health, as a as it affects health, yes. But also for us, the biggest issue that is not being spoken about is the whole spiritual meaning of water. And as I have explained from birth and all the other rituals that we perform, are based on water. And who is going to perform all those rituals on the polluted water because of the agricultural inputs, especially in our areas, because we don't have factories, but we are heavy on commercial farming that also bring all the agricultural inputs. So these are the questions that are coming on the ground. And so therefore we encourage and we are advocating for the involvement of girls, young women and women on water issues. And we are hoping, of course, to join others, because I think that is another key thing that we have realized, that we cannot do it on our own, because being in the rural area, it means we have to link up with so many others to have your voice heard because of, of the special, challenges in our country anyway. So I would like to stop there for now, hoping for questions. That will be fine. Thank you.
Thank you so much for that extremely vulnerable input. I think that sometimes ra lebala hore like re tswa mo metsing, we come from water. And ra lebala, hore re tswa kae. Sometimes it's a continuous conversation that we've been having, and especially within the Kano space, about how it is we need to find a way to amplify, our past practices as a people, so that our practices can be written down, and so we don't remember them, because I think that there's that disconnect between our health and how we looked at our health as a people before how it is now, the technological advancement elements of health. So thank you very much. That was a very, very important contribution. I would like to take this time now to introduce our next, speaker. I know that I had asked some of the fellows to reflect on what it is that they think the impacts of health are of ordinary citizens, individuals within society. I will come back to that. For the time being, I would like to introduce Nomfundo Mkaba, who is an African-centered feminist, and she has about 10 years working experience within the community development sector of Durban, and broader UKZN, or KZN rather. So the focus of her career has been in areas of youth development, of education, of environmental and gender justice, and she currently serves as a project developer for Waste for Change. Nomfundo is going to chat to us about still, on the topic of mental health, and how it is that our mental health is impacted by, the current state of our environment. And she's going to be coming from the perspective of somebody who works in the space. So thank you so much, Nomfundo, over to you.
A very good day, everyone, and thank you so much, Tlamelo, for holding the space. I think in my situation, I think another added element that we need to speak to is how connectivity is, or such technical issues are affecting participations of people who come from areas such as mine in rural community. So I'm Nomfundo, as mentioned, from the south coast of Durban in KwaZulu-Natal. I'm a mother, I'm an avid environmentalist, and I'm also a teacher professionally. So in a sense of storytelling, as captured by my previous fellow, Sibongile, I also love to tell a story. I come from a time where I grew up during apartheid, and we used to find shelter in the bushes because these were now tribal fights between Igodi, where I come from, and in KwaZulu-Natal. So we found shelter in these bushes. It continued until it became a part of me, where I realized that I need to protect nature because it has protected me in this regard. I then grew up in a space where I was around gifted people who used indigenous medicine to heal. So all of that now became a part of me in order to protect that nature heals, nature restores. So it became a part of me. And through socialization and networking, I was able to now get into spaces where I've been able to participate as an activist with organization such as the likes of Utekano and Center for Environmental Rights, counting just a few amongst many. So it then became a part of me. So fast forward in 2019, through networking again, two friends of mine, we co-founded an NPC that functioned as an NGO, which looks at zeroizing or reducing waste from the landfills, because we realized we cannot reduce carbon emissions. Let's try to reduce the waste from the landfills in the process of development, because it does not happen in a day. So I currently serve as a project developer, and I've been able to develop activities that enhance mental health for one. Like I said, there's an interjection or connection between me being an activist, a mother, and also as a teacher. I've been able to teach in schools where they are below quintile 4. So I've seen the situation of the lack of resources, the lack of infrastructures that also hindered their participation or access to education, and. So I started developing games. What we do is first we identify illegal dump sites, and then we clean these spaces, which have been very beneficial to the community, because they are now food gardens that now assist the community. So we are also looking at the prospects of where we are utilizing these spaces for indigenous games, because mental health is not just resting and also looking at just the mental health of the person. It's also play, and kids grow through play. So in order to enhance that sort of development in kids, we've developed these games where we play indigenous games like Ulayo, Ushumpu, which are games of coordination. They're developing motor skills as well, and they are also have a link to the school's national curriculum. So there's a relationship between reality and classroom activities. So then again, this child is well taken care of because they are playing, they're in a space where we are enhancing social cohesion, we're enhancing collaboration, we're enhancing teamwork. Again, as a mother, I was looking at how a mother becomes the epitome or becomes the focal point of nurturing, of full functioning of a house. And she cannot function if she's not in a good state of mind. Again, also my work laps into this, into us cleaning indigenous plantations, because we know for women in rural areas, they are fetching water from natural sources. They are walking a distance. They are fetching wood. They are taking care of their kids. They're fetching them from school, and this is far. So we never know what lurks in these bushes. So we clean them. So a woman knows that she walks in a space where she's free. She's allowed the freedom to walk and not be tense in this space, and she is relaxed to rear kids that are also positive, because she is also enhancing a sense of positivity herself. And again, with working in this space, we've worked with people that have been called Amapara. So now we are reducing the crime. This is how we look at it. We are trying to reduce the crime in the community by employing the last of these people that we think are not, or they are just community scum, but now we are rehabilitating them. So that also speaks into the states of mind, of a mental rehabilitation, because now they are not scum. They can fully function in a space where they are considered to be human beings, where they can fully utilize and be in a conducive space to also develop themselves. We're also looking at cleaning spaces, to doing resources or activities like yoga and meditation and this is welcome to everyone. And also, while we are cleaning these spaces, we are also looking at all gogo in these communities who have chronic diseases, but we want them to be in cleaner spaces where they're also able to brisk walk or do some exercises for themselves. We are enabling the space. So these are elements also of mental health. And I'm glad to be in a space where I'm creating the space for mental health, where we are looking at the resources that we have and utilizing them. Because one thing about the NPC that I'm part of, we are self-funded and we have been functioning from 2019. Also, above just the mental health aspect is also employability. So we've been able to pick up the waste and also separate them and sell them to points of outlets and get a revenue. And we've been able to maintain 30 people in the community. So that's also an element of mental health, that I can afford something. I can actually function holistically in this environment as well. And also, again, we are looking at teaching kids about climate change whilst we are playing games, we are taking care of our nature, we are being accountable. There's also an element of teaching kids about climate change. But the biggest problem that we are currently having is that some of these scientific information is not translated into indigenous languages. So it's definitely something we are looking towards developing, so this information becomes of them. This information is relatable, and they can also share it with their friends. And we are also speaking, I really loved how we started whilst we were in a pandemic, because in rural areas with the lack of resources such as water and electricity, issues of hygiene are really scarce, so they're not spoken about. So we were talking about washing your hands, clipping your nails, so the little elements into how kids, after they're playing, they put their hands into their mouth. So there's also we are also trying to get it from the roots, so they grow up in taking care of themselves and the environment that they are in. I think I've said a mouthful. I'll leave it for questions, should there be any questions. So thank you so much, Camilla, for holding the space. Thank you so much.
Thank you so much, Nomfunda. I think some powerful, powerful lessons that have come out of today's engagement. I'm so thankful to be in this space and to be taught by so many people that are doing some amazing, amazing work within their communities. I mean, quotes or some of the things that were discussed today that I want to reiterate is water as a determinant of health, the physical and the spiritual, which I think is so important, and how nature heals, it restores, it must be protected. So important. How, the use of, using things like COVID that might not be so positive as a teaching moment for kids, and how you're able to, as women, how, you mentioned, Nomfundo, that we are there to nurture, and we're there to provide. This is what we do. And our contributions, just generally within society, I think are phenomenal, and they continue to be. And I think an important element that was raised by Sisibongile as well, the fact that, women are ultimately the ones that have more access to water, because we go to fetch water to clean, we go to fetch water to cook, we wash clothes with water. So we are always at the forefront of water pollution, because we are the ones that access it the most. Very, very important, and I think profound statements that have been made today. Thank you so much. I would like, before we continue as well, to read out a comment and encourage those that are listening in to please, you can request to speak, and we are happy to open the space for you to comment and to give your contribution, because in a space like this, we are here to also learn, and there's so much we can learn from each other. So this comment comes from Tinashe, from the People Health Movement South Africa, and he says, for me, as long as we continue under the greedy capitalist system, which is being spearheaded by various governments, we won't undo the footprint. Look how our government is trying to push for systemic in the Wild Coast. Only a few will benefit, and hundreds of thousands will be evicted from ancestral land, while the rivers and the health of millions will be affected. Our farms are producing that are producing the wine we love most, which is being imported. The farmers are not just dangerous, but also banned pesticides. How do we move to address capitalism when the WHO, UN, and other bodies are mainly funded by the big capitalist governments who are in the main, or who are rather the main drivers of the environmental injustices? I think a very, very important question and reflection and thought and comment from Tinashe. Thank you so much, Tinashe, for that. Please feel free to ask to speak. We would love to get your input. I think this is a great time to sort of step back and to then go through to the next session. I'm going to hand over to Nomfundo, who is also a co-host this afternoon, who's then going to introduce our last session and the speaker who will be speaking on our last session. You have already heard from her, but I think it might be worth another introduction before she speaks. Thank you so much. Over to you, Nomfundo.
Thank you so much, Tlamelo. Another powerhouse. I really think KZN hasn't been reckoned with, and I think it's about time. And I say this because of the likes of Usibongile, who's really pioneering some great initiatives on the north of KZN. And I really feel once we speak about the girl child, and a lot would change. We are speaking about women versus motherhood. We are speaking about people that will rear, that will matriarch. And I'm so glad that she's really taking a relay of this, and siyabonga Sisibongile for doing such a great work. Also, Sisibongile Mtungwa is from the Women's Leadership and Training Program, which is known as the WLPT, which focuses on gender leadership and development for girls and young women around the issues of water, climate change, and biodiversity. Sisibongile, over to you. The floor is yours.
Okay, thank you very much, Fundo. Thank you very much. This is, for the introduction. I think I'll just focus on what is happening right now. The Access to Water project has been supported by Tikano, and we're very grateful for that. And I have said this some time before to other people, that this is one thing that has been going so well for us. So that's why we thank Tikano for this. What is happening is that about 200 girls now have been involved in this process. The process builds the leadership of girls, and not just because we want to, but because the girls want that. The girls have demanded that from us from way back, to say we are the affected, we carry the water, we know all the pain and the struggles and everything. So we want to be involved, but also not just as the victims of the whole situation, but they want to be involved because they believe they've got solutions that they can bring on the table. And they think that the other solutions have been brought, but they are not really responding to the need and on what is happening on the ground. And I'm going to give one example. When they engaged with the local government on the My Right, My Water, My Right campaign, that was to speak with the party candidates on their manifesto, to say, what are you going to do on water, girls, young women, and women once you are elected? What was shocking at that time was that the many things that the girls discovered, and I also didn't know about those things, that there are water schemes at the municipal level that have been done since, that have been initiated since 2012, and today it's 2022. Those water schemes are not completed for one reason or the other. And that was a shocking thing, but it explained on why girls today and in South Africa are still experiencing water problems and still have to walk long distances to fetch water. In that process, the girls established that most of the candidates had no clue on what is girl, women, or young women's right on water. They had no clue on how they are affected. So during that process, we have seen all those gaps in the municipality, but at the same time, we are seeing the opportunities on what could be done by the girls to bring about the councillors at the moment talking about water issues, not just talking, but engaging with the young women and women on the water issues. So that is one activity that the girls are doing. And the second one is has been to work with the traditional leaders, to say to the traditional leaders, if they are involved in development of their communities, how come they don't have girls in their councils? And that has been a very interesting process as well, because previously, before this process, there was no involvement of girls in the traditional leadership councils, and now as we're speaking, girls sit in those councils. Well, it's still a bit informal because they are not registered as council members, but they are allowed to participate, to present, and to influence how things should be done around water, and to educate the council. And that has been an added value to see girls educating elders in their communities based on their experiences. And the other part that has been also encouraging is to see girls testing water, using the basic scientific tools to test the water, understand the water quality, what is it that is really in what toxic things are in the water. And that process is as much as it is a scientific exercise, but also it brought the whole thing of girls seeing themselves being the first people in our communities to test water. Usually those exercises are done by people from outside the community, and no one ever really knows about the results and the findings and the results. So the girls conducted these testings of 15 streams, rivers, and springs. So when they brought back the findings from the laboratory, they were able to translate it into language that is inclusive for everyone, whether you are educated or not educated, and to simplify it for older people, simplify it for other kids, and simplifying it for other people who well, unfortunately, we haven't reached the point where we simplified for people who couldn't, who can't see. We felt that was a gap, because we felt that they cannot see the picture developed by the girls, telling about the findings of the findings of their study. So these activities, what they have taught us is that girls, all the time we talk about them, we talk for them, but their agency, their voice, their activism is not of tomorrow, it is of today. And if we are about not leaving anyone behind, we should make them to be in front, not because we've got the power to make that, but because they have got the power to tell us what they want. And the best thing that we can do is to support what the girls and young women are doing and what they are teaching us. I believe that going forward, the girls, especially linking it with South Africa, the activism of girls and young women in other continents, like in Europe and in the US and other in the north, you can see where that activism is. The dream or the goal of the girls is to build the stronger activism in Africa, in South Africa, but also in the African continent, on how girls communicate and teach each other around the issues of water, climate change, and biodiversity, but also how do they begin to lead today, not tomorrow. Thank you.
Thank you so much for that, Sis Bongile. Some phenomenal work that you're doing. Again, I'm learning so much from you, and I'm so grateful to have you in the space. And one thing that I loved is how the activism in your work comes out, and how the advocacy in your work comes out. And I quite found it quite interesting that your advocacy is not it branches out. The fact that you're able to have conversations with the traditional leaders within your community that then brought about a change and an incorporation of more women within that structure, I think is phenomenal. So thank you so much for that. And I think that it's so important when you talk about how young women and young girls have agency and have their voice and have activism. And thank you for allowing and giving them the platform to actually advocate around water related issues within their community. And by so doing, they're also teaching those that they go to school with, those that are younger than them within the community. I mean, it's amazing at just how much that work can do. So I would like now to take this time to just get some final thoughts. We are coming to the close of the session, and I think it would be great if we can have some final thoughts from the speakers, and importantly, if we can have some final thoughts as well from the listeners. What you have learned, if you'd like to share, or what it is that you would just like to share. It doesn't necessarily have to be from what you've heard about in this particular session, but it could also just be about the work that you're doing, because like we're saying, and like everybody has been mentioning, there is quite a bit of intersectionality between issues that have been raised on this platform. And I think that in our advocacy, we also need to remember that, and we need to ensure that when we are doing advocacy, we use the different levels available for the work that we are doing. So whether that's at a grassroots level, so whether that is at a parliamentary level, whether that is at a legislative level, whatever it is, we use all levels in order to actually advocate around environmental health and how that is impacting us, around the right to health, and around the right for us to actually grow up and thrive in an economy, and rather in an environment that's not going to be endangering to our health. So I'm going to open the session to the floor and encourage people. As mentioned, you can request to speak, and there is somebody who can actually allow you and open the mic for you. You have to open the mic yourself, but can give you speaking capabilities. So anybody who feels to jump in, please do so as we look towards closing. Thank you to everybody who's joined. I hope you got as much from this session as I did. Thank you to everybody who contributed, to the speakers. Thank you for the work that you do within the communities that you work, and generally contributing towards the conversation around environmental health and health within South Africa and globally as well. I appreciate you. Open to the floor.
Hi, Tamela. Just I think in closing, while others also contribute, it really is unfortunate that institutions that are supposed to safeguard communities are the ones that are making decisions that will have irreversible consequences for our health, mental health, well-being, and our livelihoods. But really, just to say, we really need to be prepared. We know that the COVID-19 pandemic showed us that preparation is everything. And so in the case of climate change, it's already here. We really need to be resilient, to adapt. And we really do call upon our government to realize our rights, our right to a healthy environment, our right to health, and really protecting our livelihoods. So really just those are my closing remarks. Thanks.
Okay. Thank you, Mafoko. And also my closing remarks on this matter, colleagues, as we are and looking at our theme and at our health, some of us as professionals, we are doing our part, to address climate change, but we would need a collective approach. I won't change the world by myself, but if we have a collective of initiatives and approaches that are aimed at addressing climate change, then we will win. They say together as one, phambili siyawina. So I think in closing, I would like to say we should focus more now on sustainable practices that are aimed at addressing climate change issues or climate change challenges that we are facing at our own, individual capacities, wherever we are. What matters is the initiative. Thank you.
Thank you so much. Over to you, Sisibongile.
Okay, thank you very much. My closing remark will be an invitation, and this is a physical invitation, a invitation to be there physically, but also we know that you can be in a place, in a space more than physical. Towards the end of this month, we are hosting a one-day celebration for girls, young women and women, but also the community, based on the healing of girls, of women and young women in our communities. And it's going to happen around the water source, one of the water sources, which is the river. And what's going to take place there, it's within the theme of presenting myself to my source, which is the water, but allowing my source to heal me. Because as I've said before, there are so many stories that are not good, the painful stories of girls on the way to fetch water, and it's not supposed to be like that, as we know that the water sources are spaces of peace, of healing, of spirituality. So we want all the girls, everyone present to get into that that true meaning of water, so that we begin to change the painful story to the positive story. So we will send a written invitation on it, but if you can join us on that day physically or spiritually, we will be happy. Thank you.
Thank you so much, Sisibongile. Over to you, Prajesh. Thank you so much.
Hello everyone. As the topic is our planet and our health, and it is the theme of our World Health Day to 2022. And as we are very good concern, well known that if our planet is healthy, then in this way we can be healthy. So let's make our planet Earth more healthier, more greeneries. It should be we should produce less carbon contents. We should try to use public transport compared to individual or personal transport, so that we can cut the carbon emissions to make our planet and our self healthy. And as the health is related, very much related to with our planet's health. So we should try to protect our animals, such as that wild animals, through which our food web chains are also connected, and our nature's balance, in this way our nature balance will not disturb, and the protections of our health will get be connected. Thank you so much. Thank you, over from my side.
Thank you so much, Mr. Prajesh. Just I'm going to hand over to, and I think if we can make it, just because of the interest of time, to Mahesh. My apologies, I hope I'm saying your name right. not to rush you, but please do also, in the interest of time, I think I will probably give you a minute or more, Mr. Mahesh. Thank you so much. Over to you.
Hello, good evening, guys. The five elements measure are the water, air, land, and this air. So, if these elements are the purified, our health will be good and healthy. Suppose air is polluted, our health get damaged. If we take care of our air, water, and the soil, we can take care of our health. If we are polluting the air and water, so our health is indirectly polluted or get damaged through. So we need to take care of our ecosystem and friendly animals so we can take our health. That's I want to say. Thank you.
Thank you so much for those, very important contributions. We really appreciate them. I'd like to take this time to again thank everybody for joining the session. I think that it's time we wrap it up for the day. We are about 15 or more minutes over the time that we had planned for the session, which is always a good thing because if you go over the time you planned for a session, it shows engagement. So thank you so much for everybody for joining. I wish you a very good afternoon further and all the best for the rest of the year. Do take care. Thank you.
Thank you.
Thank you, everyone.
Thank you very much.